Hello ma'am. Could you explain MDT in the context of cancer care?
So MDT is MultiDisciplinary Tumor Board, which means it's a collaborative meeting between all the subspecialists in cancer while dealing with a cancer patient.
Hello Dr. Shweta. Who are all involved in the MDT cancer care?
It involves multiple subspecialties which include doctors, medical oncologists, radiation oncologists, surgical oncologists, and again subspecialty like urologists if in case of urological malignancies, gynecologists, gynecological malignancies, and even clinical assistants and nurses who will help in major care of the patients.
Thank you. Hello ma'am. What is the benefit of MDT for the patient?
See, the benefit to the patient is remarkable because you get all subspecialty inputs, which makes our practice better. The outcomes are improved because we have knowledge from all subspecialty, which normally every patient is treated in various ways. They may require radiation at some point in time, they may require surgery, or they may require systemic therapy. At the same time, there will be molecular scientists who will be discussing NGS reports. So when we take all these inputs together, the end result to the patient is much better, and at the same platform. They don't have to visit subspecialists and do separately understand things and then put it together. Instead of that, in one platform itself, everybody's inputs are given and they can be easily correlated to make it more productive for the patient.
Thank you ma'am. Do you think will there any survival benefit with the MDT? Does the quality of care improves with the MDT?
It's a very good question, Madhu, because there are several publications across the globe, across the continents, in which it is said that whenever a patient goes through an MDT, the results to the patients are much better. There is improved survival noted, and there are studies which show, because these are studies which just correlate data, and the meta-analysis have shown that the results are much superior to the patients who have gone through MDT.
Thank you ma'am. Hello Shweta. What is site-specific MDT in the cancer care?
Site-specific MDT is based on the subsites, mainly thoracic MDT, which covers the breast and lung majority, gynec MDT, which covers the endometrium, ovarian and cervical cancers, urological MDT, hepatobiliary MDT, and much more based on the subsites where the cancer is occurring. We have a tumor board, and also based genomics based molecular MDT, which is now which is a main for precision oncology.
So what she's saying is molecular tumor board is also something which has come up, and now we have AI driven tumor boards in which actually we have collaborative practice across the globe. So they are global tumor boards in which all the subspecialists including molecular biologists are sitting, and they give inputs on molecular profile of the patient, and therefore we can personalize care or individualize care.
What is personalized medicine in the context of cancer care?
So that's a very useful and actually a very practical question. We have to understand that initially there were 35 tumor types. You will call them breast cancer, gastric cancer, cervix cancer. But there was a TCGA atlas, which is Cancer Genomic Atlas, which actually subtyped cancer based on molecular profiling. So no two gastric cancer, no two breast cancer, or no two lung cancer are the same. They are subcategorized based on the molecular presentation. What is the mutational pattern, whether they have any molecular aberrations noted. Now this leads to different treatment, even if they have same stage. Two patients with the same stage, same type of cancer also are treated in a different way. And we have to personalize care based on the molecular aberration expression. And that's known as personalized care or tailor-made care. And they may actually have different sequence of therapy, or they may have different type of immunotherapy or different type of targeted therapy.
Thank you. It's a very good piece of information for the patients. Hello ma'am. How common the prostate cancer in India?